I've seen clients coming back to the facility with different complaints wakishapata dawa ya Depo Provera. Actually, I'm a nurse and this I see almost kila siku. Mtu anakuja na complain like mimi toka nidungwe natoka damu nyingi, mimi toka nidungwe I don't feel like having sex, mimi toka nidungwe I'm always tired, and so many complaints. Yeah, we do counseling before getting into an agreement by a client. Hii ndio dawa yenye anataka kutumia. But again, the side effects of Depo Provera ni kama kuna knowledge gap mahali. So this is the injection that you always go to take after every 3 months. Unaenda unadungwa sindano ya family planning. It has a hormone known as progesterone hormone. Progesterone is a synthetic form of hormone progesterone. Kwa mwili yako as a woman, you have these hormones naturally. You have the estrogen, you have the progesterone, all these hormones at controlled levels. So the function of this hormone progesterone in your body is to suppress ovulation. Inazuia ovulation kwa mwili yako. Ina change the natural lining ya the uterine lining hiyo. Actually, once there is an injection of hormone progesterone in your body, it will lower the level of hormone estrogen. Function ya hormone estrogen kwa mwili yako ni kuthicken the uterine wall, inakuwa thick, inakuwa smooth, inakuwa vizuri. But hii ingine inaifanya inakuwa thin so that when there is fertilization, hakuna place mtoi atajitouch. That is another thing. Alafu another thing venye hii hormone ya 3 months inafanya ni ina create a build up of the mucus plug. So unajua during ovulation the mucus has to be very slippery. Again, while using Depo Provera, the mucus plug inakuwa thick, uji so that the sperms cannot penetrate kwenda commit an egg. That is how this hormone functions. When it comes to side effects, this is what happens. First, I've told you the function of hormone progesterone naturally kwa mwili yako. This is the same hormone yenye unakwanga nayo during pregnancy. Yeah. It prevents ovulation. You know, once you are pregnant, you cannot ovulate because of this same hormone. During pregnancy, hormone progesterone itakuwa kwa mwili yako kuzuia ovulation. Now, ukidungwa hii dawa ya Depo Provera, chemically you are pregnant. That is what happens actually. Chemically you are pregnant, but you're not pregnant in the real sense because you've been added hiyo dawa kwa mwili yako. The same dawa yenye inafanyaga nini? Ina support pregnancy throughout mpaka time yenye mama anajifungua. Sasa we after every 3 months unaenda unadungwa, unakuwa chemically pregnant. But again, look on the side effects of this drug. Bleeding, different types of bleeding. Actually, we have the breakthrough bleeding. You can be bleeding heavy and in clots. If you see such a symptom, please go back to the facility ili usaidiwa mapema. Kuna hiyo bleeding ya ile tu naonanga tu chafu kidogo. It's not that much. That is what we call spotting. But again, it can be irritating because you cannot even enjoy your sexual life while you're having spotting. It can even come with cramping. Another one is we can have bleeding in between your periods. Yeah, you've just bled it fast as your periods. You are expecting to be bleeding on date 28th of the same month, but again on date 14th you are there bleeding. It's just in between your periods. Bleeding is not healthy as a woman, and it is just hormonal imbalance. And that is why you find like when you are bleeding and you're coming back to the facility to get help, we will always prescribe for you the double hormones, the hormone progesterone and hormone estrogen. Inaitwa combined coral, ile imeandikwa chaguo langu, because tunataka kubalance the nature. Hii venye umekuwa ukidungwa hiyo progesterone kwa mwili yako, it has interfered with the natural balance of your hormones. Another thing is that the side effect that is not really known to people is that Depo Provera has a potential of reducing your bone density. Yeah. While using Depo Provera, kuna hiyo uwezekano ya mifupa zako kukua weak. Yeah, it delays your return to fertility. A single shot of Depo Provera, just a single shot, can delay your return to fertility for a period of about 10 months. And again, on this one, the time frame varies. we don't have any specific time frame of when you can resume your fertility after stopping the use of Depo-Provera. This is why it's not really encouraged on girls. At all, you can use other methods where you can get your menstrual cycle naturally. It can be very good, and these methods include the barrier methods. In the barrier methods, we have the condoms, we have the intrauterine device, or even the natural methods. All these hormonal methods got really severe, really bad side effects. Over 90% burden of contraceptive use lies with women compared to men, and this is why it's very, very important that you as an individual, before making that choice that this is the method that I want to practice, this is the method that I want to use, it's always advisable that you understand each and every method that you are going to use.